Doctors of Reddit, what's your best they came in for a small checkup and ended up needing surgery story? Not a doctor, but I worked in an emergency room in nursing school. I was sitting out in Trigilate one night. My nurse had ran to the back for a minute and a guy comes in. Only complaint was a sore throat. Nothing else at all. Just a sore throat. But something was off. He had a slight grayish tone. As a tech, I figured why the heck not. Told him to follow me and took him to our EKG area. Few minutes later, my nurse comes back and is looking at me like I'm nuts because I'm doing an EKG on a sore throat. I handed her the printout and she had an oh crap look. He was having a steamy, massive heart attack. My charge nurse came out later after the dust had settled and asked me what made me check him. I told her I didn't know, he just didn't look right. Intuition can be a funny thing. Poor guy. He was slightly confused about the whole thing. He just wanted something to fix his throat irritation. As someone who nearly died because the doctors did only look for horses, not zebras, I'm glad to read that there are other examples where the zebra ist found in time. Keep listening to your intuition. I went to my doctor thinking I had a bladder infection. I felt like I had to pee every 5 minutes. Doctor found nothing but sent me for an ultrasound. Turns out I had a cyst the size of a grapefruit on one of my ovaries that was resting on my bladder. 5 days later I was in the hospital having my ovary removed. I was the patient. I worked construction for a living and was working a job removing some very heavy laminated glass. Strenuous lifting all day long. During the course of the gig, my left testicle began to swell and hurt, and wasn't getting any better. I told my supervisor I suspected I had given myself a hernia, not unheard of in my field, and went to the occupational healthcare clinic in town. The sweetest grandmotherly physician did the whole turn your head and cough deal. Awkward, necessary, but yielded nothing. She recommends I check myself into the emergency room and get an ultrasound. Well, when the ultrasound tech finished the session by saying good luck to you, buddy, I suspected something amiss. Well, one removed testicle, a round of chemotherapy, and an abdominal lymph node removal later. Testicular cancer hasn't beaten me down. I'm awaiting my 4-month post-surgery CAT scan now. Fellas, check your nuts. Look at this guy, only has one testicle and has more balls than me. Hope you'll keep your family jewels safe and congrats. I remembered a second one. I teach an EMT class on the side and we were going through rare medical conditions that you can identify with little to no equipment. Your aorta is the biggest artery in your body and if anything happens to it, it's a big problem. It can develop an aneurysm. Think a semi-failure of the wall, causing it to balloon out to the side, pending full rupture. I'm explaining the ways you can identify this in the field, one of which is to take both the radial pulses, wrist, simultaneously. They should beat together. If they are beating off tempo, that can be a sign of an aortic aneurysm. I tell everyone to partner up and take both their partner's pulses so you know what normal feels like. A hand is raised in the rear of the room. You Sam Neill. My partner's pulses are wrong. I start by joking that students need to be more diligent in practicing taking vitals etc until I take the student's pulses. Hers are indeed wrong. The head instructor and I go into work mode and do a barrage of other tests. She shows additional signs in a couple, but not all the tests. We advise her to go to the hospital immediately. We explain that if you have an aortic aneurysm and it ruptures while you are on the operating table of the most skilled surgeon in the world, your odds of survival are around 2%. She refuses and finishes class after we do sire paperwork. She follows up with her doctor from childhood who, as she tells it, drags her by her ear into the ambulance he called. It turned out to be a very minor aneurysm, and she had a procedure to repair it and takes medication to keep her blood pressure low, but otherwise has a completely normal life. Not a doctor, but a paramedic of Reddit. When I was a brand new medic we got a call Sunday morning for a 20-something-year-old male vomiting, with a small amount of blood in the vomit. I speak 2 languages. My partner at the time was from a former Soviet bloc country and spoke about 5 fluently. Believe me when I say this guy got cursed out the entire ride to his house in 7 languages. A 20-something-year-old called because he was throwing up on a Sunday morning? Dude, you have a hangover FFS. We arrive and are met downstairs by his girlfriend who is panicking and confirms they went out drinking the night before. We roll our eyes, grab our gear and head upstairs. As soon as we see the patient our tone changes. Guy is Asian, but is paler than printer paper, soaked with sweat, is cold when I touch him and is barely conscious. I look next to his bed and a small amount of blood in the vomit is in reality a medium-sized garbage can, almost 1 stroke 4 full of straight blood. His blood pressure is low, around 70/30. His heart rate is compensating by beating at about 160 times per minute. We get a big IV in him and replace about a liter of fluid. His vitals improve. He comes around enough to answer questions. He says he drank 2 beers last night and smoked some pot. He says he has never been able to have more than a few beers without getting sick for days. I ask about his medical history and he says he has had general digestive issues his whole life but never anything like this, just has to have a low-fat diet or else horrific diarrhea, bad hemorrhoids, low-grade abdominal pain constantly but has never been given a clear diagnosis. Nothing on paper to go from. We get him to the hospital and drop him off in critical. In one of my only true Dr. House moments, as I'm walking out I tell the trig nurse exactly what the issue is. From the deepest depth of a half-slept-through lecture during paramedic school, I remember all these symptoms. He has an undiagnosed liver issue, which is causing blood flow through his liver to get backed up. When the liver doesn't work properly, you can't digest alcohol or fat effectively. When blood starts backing up it causes portal hypertension which causes hemorrhoids and basically hemorrhoids in the esophagus, called esophageal varices. One of these varices has popped and he was bleeding out through his esophagus. One of the only times I have correctly diagnosed a problem beyond hey this drunk guy has been drinking alcohol. Dang, that is definitely a Dr. House moment. A couple years ago, my mom was experiencing crazy back pains. She went to this one doctor every so often to get some pain medication and that doctor, for the life of him, couldn't find anything wrong with her, but could tell she was experiencing major pain, so gave it to her. One day, she's going in again and her doctor is out so she has a different one. While being checked up, the doctor says, "So you're here for the broken back?" Then and my mom was really confused. Apparently, in 1999, she had been in a car accident where a tanker truck carrying gas rolled over her car and crushed her inside, but nobody had apparently noticed that her back was broken for almost 16 years. She had surgery on the day of my birthday and she's been a happier and more easygoing person since. I'm not a doctor but I still have a story. My dad had a bad stomach ache. Didn't know the cause. It was bad, but we thought it was just a bad case of food poisoning. He was in emergency and the doctors saw a burst appendix, so they took him in for surgery, opened him up and it was stage 4 cancer. He had several tumors removed and had to go to chemo. On chemo, got better, then got worse, another surgery, deteriorating health, just pure chaos. This was 4 years ago. He died just last year. Well, I'm sure he lived a good 3 years afterwards. At least I hope he did. R.I.P. Doctor here. I had one a few months ago sent into the hospital by his primary care doctor with shoulder pain. He said he felt absolutely fine, just a really uncomfortable right shoulder pain that hadn't gone away for a couple of weeks. He maybe felt a bit more tired than usual and come to think of it, had lost quite a bit of weight recently and none of his clothes fit him anymore. I went to examine him and had what we describe in the profession as a heart sink moment. He was jaundiced, and his abdomen was absolutely solid in the right upper zone from a huge, craggy liver. Get him in the CT scanner and he is just full of cancer everywhere. Couldn't even work out which was the primary. The shoulder pain is what we call referred pain and is commonly caused by diaphragmatic irritation, in this case from all the liver masses pushing against it. Bless him. I think about him a lot. I'm the patient. I went to my doctor because I was tired. I asked to get my hormones checked, but my doctor is thorough and did a full exam and workup. During the internal exam, I'm a lady, she said she felt something weird and referred me out for an ultrasound. I had an external ultrasound and a transvaginal ultrasound that took nearly an hour with the tech snapping pictures the entire time. Super fun-ass. Unfortunately the ultrasound didn't show anything clearly. Whatever was wrong with me wasn't an issue with my uterus. My doctor referred me out for a CT. I went in, drank the gross goop, and they took a bunch of pictures of my pelvic region. I get a call from my doctor who says I need to meet with a surgeon right away. I get an appointment the next week. If you haven't had a CT scan done before, it's a series of images that are slices of your body shown as contrast in black and white. As the surgeon scrolled through the images, they showed the inside of my pelvic region slowly becoming full of white as he scrolled up and down my body. I had a tumor the size of a football in my pelvic region, and the only symptom that prompted me to go in was feeling so tired I couldn't finish a normal gym workout. Looking back, I also realized that I still felt like I had to go to the bathroom sometimes even though I had just gone because it was putting pressure on my bladder. They scheduled surgery for a few weeks later. Because it was my entire pelvic region, they weren't sure what they would find when they went in, like what was tumor, what wasn't, and what it was attached to. There were at least 3 specialists in the room with my general surgeon. It was actually much better than thought. Took about 2 hours to remove. No major organs involved other than a few internal lady bits, and only minimal side effects. The biopsy showed it was benign. Not a doctor yet but a student. I haven't seen the worst kind of stuff yet, but this was a fun one. I'm shadowing a GP at her office and a guy comes in for a routine checkup a few weeks after surgery on his toe for an ingrown nail. Doctor asks how he's doing. Guy is like, fine I guess. A little tender? She says okay. How does it look when he cleans it? Guy says he doesn't know. Turns out he was still in the same dressing they gave him at the hospital after the surgery. Never even opened it. Had just been walking around in the filthy thing for weeks. Even the experienced doctor was struggling to keep a neutral face when she opened that dressing and the smell came. It was bad. Not a doctor. Mom was the patient. She went in to get a regular checkup, renew her prescriptions, etc. Mentioned that she had been having pain in one of her fingers. She had put off getting it checked cause she was thinking it was just arthritis. Doctor refers her to a hand doctor. Turns out it's a tumor that's wrapped around her bone and tendon. She gets surgery to remove it tomorrow. Not me, not a doctor. A friend who is the definition of anti-establishment, anti-vax, anti-anything science-backed, always had a little bump on her nose. She put her oils on it, smudged with sage to remove the toxins, and regarded it as her beautiful bump. The bump gets bigger, darker. Her grandmother supposedly tricks her into going to the doc about it. I think she was supposed to be helping grandma to her own appointment, but sneaky grandma had other plans. Anyway, Miss Alice Cure Everything is currently in hospital having the entire left side of her nostril and part of her cheek removed due to skin cancer. And she'll probably claim for the rest of her life that she was doing just fine until the hospitals cut her face off. Not a doctor, but the patient. Went in to get my shoulder looked at because my rotator cuff was being a bit of a dong. No one had looked at me shirtless in at least a few years beforehand. So imagine the collective surprise when we discovered my mild scoliosis had progressed to a visible deformation. I just got extra unlucky in that I developed an 84-degree curve one way and an 85-degree curve the other way, so I never developed the telltale scoliosis lean. Ended up having spinal fusion done within 5 months because it would have been dangerous to do it any later. Not a doctor, but my dad has a pain in his back for a week or 2. So he went to the doctors to make sure it wasn't more than a pulled muscle from catching for me when I practiced pitching in middle school. They did some scans, and he ended up being diagnosed with lymphoma. I like to say my wild pitching saved his life. He's been in remission for a few years. Never figured out what the back pain was. Could have been referred pain. Not a doctor, but my dad's skin was itching a lot and creams or allergy meds weren't giving relief. Went to the doctor and found out it was stage 4 liver cancer. He died 2 weeks later. We were all nuts for a while after that one. I am so sorry for your loss. I'm not surprised you were all nuts after that kind of shock. Itchiness seems to be a symptom of several very serious endocrine things, to the point where I think it should be better known as a danger sign. Obligatory not a doctor. This happened to an old co-worker of mine. I was a supervisor at a truck terminal. One of our delivery drivers was moving a pallet in his truck when the wheel of the jack caught some debris on the floor of the trailer, and he pulled something in his abdomen. He went to the doctor either that evening or the next day, and in the middle of the exam, The doctor basically just stopped and told him to go to the hospital like right away. It turned out he had a baseball-sized tumor in his abdomen, and it wound up being malignant. He died like half a year late. R.I.P. Jimmy. My mother was the patient. She and my grandmother had been in a car accident with a drunk driver and were being checked out for whiplash and such. As they're signing discharge papers, a surgeon comes running into the room and says my mother can't leave. Apparently she was missing her top 3 vertebrae. Her neck was being held in place purely by muscle. She was one of a handful of people ever found with this problem past the age of 2, and most are only found on autopsy, so they ended up taking a chunk of her hip bone, sculpting it, then fusing it all together with enough wires to set off metal detectors for years. Not a doctor, daughter of a patient. For years my dad complained of gut pain. He went from doctor to doctor and they all said oh it's just a stomachache or even it's all in your head. Dad went to one doctor that took him seriously and did a scan. Turns out his gallbladder had died. Hey, that just happened to me. Cheers to your dad. Not a doctor, but my dad had a bit of pain that wouldn't go away 3 years ago. Sat through all of Christmas morning, then as soon as my family and my sister's family left, he took himself to the emergency room I grant. But only because it was Christmas so there weren't any walk-in clinics open. He had freaking pancreatic cancer, and in the end he got the Whipple procedure done. Then chemo after and latest news from his doctors is that it's 100% gone, which is phenomenal for pancreatic. Holy freaking crap, that's amazing. Oh, I get chills down my spine when I hear about someone having pancreatic cancer tbh. Given how late it's usually found and the resulting poor prognosis, so I'm over the moon for your dad. D. Oh boy, as part of our medical course, we need cannulas ticked off. Another medical student and I went to the ED, where many patients need cannulas. We found a fantastic nurse willing to supervise us, who recommended a patient with easy veins, for example. Young, no urgent problem. Young woman with vague 3/10 abdominal pain was trig low down on the list, so she was perfect. It was the other medical student's turn, so she begins rummaging through the drawers for equipment. It's apparent she doesn't know what she's looking for. The nurse helps. Student sets out an enormous needle, 14G, the kind you'd use for a blood transfusion. Nurse gives her a weird look and replaces it with a smaller one. It becomes apparent this is the student's first cannula. After poking several random areas, she enters the vein, and then she does nothing. Doesn't release the tourniquet, doesn't put a bung cap on it, does nothing, while looking at the pathology tubes blankly. The nurse is telling her to put the cap on it, but the student is still obviously trying to figure out whether to attach the pink or the yellow tube. Blood is gushing out. The nurse tries to hand her a cap. Student doesn't notice. Patient finally looks down. Blood everywhere. Over her arm. The bluey towel placed under the arm. Chair. Reaching her pants. The patient's face goes ghost white. Even her lips turn white. Her eyes roll back into her head. Before I know it, she's passed out. The cannula still isn't capped. The nurse is desperately trying to hurdle over the student and the trolley to cap the cannula or take it out. Student is still standing there, not moving out of the way. Flummoxed. I grab another nurse and we find a bed to transfer the patient onto and elevate her legs. The patient is rolled into resus, where there are bigger bays. There's so much blood on the floor that the wheels of the bed left a long, red trail across the emergency department. In handover later, I heard she was hypovolemic and they were keeping her for a while until her red blood cell count was returned, to confirm she wasn't anemic from all the blood loss. TL. DR. Woman came in with vague abdominal pain. Ended up admitted for violent blood loss. Afterwards, I heard the student asking the nurse if she would tick her off for the cannula. I was expecting the story to take a turn saying the student had an aneurysm or something. Not a doctor, but I've got 2 stories where I thought I was fine being ridiculous over the whole thing. First one, I thought I had really bad period cramps which kept getting worse to the point I couldn't walk. Turns out I had an ovarian cyst burst on me, and I spent 6 hours in the waiting room hunched over in a wheelchair because the nurses thought I was just trying to get out of school. Second time I just thought I had a sore throat. Did the strep test and everything, which came back negative at the walk-in clinic. It proceeded to get so bad that I couldn't swallow and I was vomiting up whatever I ate, but I was determined that I was just being a wimp over the whole thing. My sister came home, felt my forehead and immediately called our grandparents to take me to the hospital. I sat in the ER for 4 hours because she made me take an all-in-one sort of thing for sore throats, which also included reducing fevers, so the nurses probably thought I was being ridiculous. It turns out I had cellulitis in my uvula and it had swollen to 3 times its usual size. Don't know how I got it, but work sure was thrilled about me calling in sick for a whole week during busy season. There's a difference between your soft palate and your throat, and that definitely makes a difference when doctors are trying to diagnose you. Daughter had a burst ovarian cyst. We thought potential appendicitis. Doctor put her into a wheelchair and rolled her right to her, but fortunately no surgery needed. Later we heard how her grandma somehow had one while pregnant. Women's bodies are dang complicated. It happened to us. We took our daughter for scheduled well baby check. She had a strange little bruise on her head that we wanted to ask about, plus it was time for vaccines, etc. Left 2 hours later by ambulance to PedsIQ. She had a brain tumor the size of my fist. The bruise was caused by pressure inside her skull. A few more days and she likely would have had major symptoms, seizures, etc. We were totally dumbstruck, had not idea there was a problem. 12 surgeries, 2 years of chemo and years of therapy have her doing pretty well. She has permanent disabilities but she's happy and relatively healthy. I went to the doctor trying to get a sick note so I could call out of work because my stomach hurt and I threw up a few times. I ended up in the hospital for 24 hours needing emergency surgery. I was pee off. All I wanted to do was go home and play video games, but I was stuck watching hospital TV. Not a doctor, but it happened to my Phil. Went in to have his stent replaced, as he has done a few times already, but this time doc says there is too much blockage and schedules an emergency bypass ASAP. Went from a checkup to open heart surgery in 2 days time. Not surgery, but I had a guy come into the emergency after an unwitnessed collapse. He was young, early 50s, but had been diagnosed with a myriad of what are often known as exclusionary diagnoses, such as chronic fatigue syndrome. If nothing else can be found to relate to her patient's symptoms despite numerous investigations. From what I could discern, he'd been seeing his doctor for years for motor symptoms and weakness, and they'd always told him it was all in his head. Well, they weren't wrong. I did a scan and found a bleed tumor. Tried to follow up, but as far as I could determine, he self-discharged. Definitely explained all the symptoms he'd been experiencing all these years. Student nurse at the time, 30-something YO male presents to the ER with complaints of abdominal pain. Looks jaundiced. After history taking, find out patient had been admitted before due to liver cirrhosis but refused any and all treatments due to him saying it's too expensive and that he could tough it out. Called over the intern to call their attending and that it needed to be looked at stat. While waiting, I find out that it had been months since the diagnosis. Attending and intern show up, begin interviewing, lecturing, treating patient, begins to writhe in pain. I ask the doctors if I should call for a code because the patient isn't looking too hot. Eventually the patient passes out and the doctor yells at me to call the code. Patient died, but turns out it would have been way too late to do anything about it. Another not a doctor story. My dad always had some back pain because of his job as a mason. One day he came home and it was just a bit more intense. He then took a hot bath like he always did and went to bed early because the pain didn't get better. The next morning the pain was still there, so he was like, frick it, I'm going to see the doc and get my day off. The doctor did some checks and a few minutes later he was rushed to the hospital with a severe heart attack. I still wonder how he took it quite easily because it almost killed him. Now, 15 years later he's fine and never had any problems besides short breath and being physically weaker. Not a doctor. However, I feel I have a good example to contribute. Couple years ago my grandfather was complaining about minor chest pain. He said it was only when it was cold outside and he found it a little hard to breathe. This is the first time in his life this happened, so he didn't know what it was. We ended up taking him to the doctor, expecting it to do with the cold weather taking a toll on his 81-year-old body. After a couple appointments, he found out he needed a triple bypass. In very brief terms, for those who don't know, a triple bypass is clearing any obstruction from 3 of the 4 sections of your heart. Had we not taken him for this small doctor's appointment, who knows how much longer he had before the lack of blood stopped his heart. He got the surgery ASAP and he's still alive and well today. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.